and co-founder of paraclinical assistant startup aka RNS. In this series of video, I want to talk about our doctor panel in the neurological disease system-based neurological software. So join me, and I want to talk about our specification and our services in this software. So I want to dig into our application and talk about their features and a different type of problem that this panel can solve. Join me. Okay, after you register in our website and our application, you can log in to your national ID with your national and your password in your panel, in your account. Okay. In your dashboard, you can see different type of features. You can see our menu bar that have a different tab, profile tab, patient links, medical advice, financial tab. You can choose your English or Persian language. Also, you can see two features: notification in your system that can help you, show you different feature in your application and your every work you done in your panel to your panel, and your messaging. I will explain about more. And you can see two icons about patient list and medical advice. Okay, in the profile tab, you can change your photo and reset your password and set a new password for your system. And in the patient list tab, you see a different status. You can see a standby that your doctor, or if you are a doctor, as a doctor, you can change, you can set and accept your patient based or this feature. You can see their description, their type, their disease, their date, and their national ID. And if you accept your patient, then this patient go into the processing tab, and you can see them. And you can see the details about your patient. You can see the tests and the trials which they send to you. You can see their prescription, their history, and also you can see the action and articles. In that section, you can see disease history and other parts of that. I will go to the patient list, and in the processing tab, I will choose action part. In the action part, you can see the three different icons. For example, in the first part, you can see the medical prescription icon, and I will select this part, and you can see your prescription for your patient. For example, in the first tab, you can see the dietary recommendation. You can choose their disease, or after that, you can set the proper condition for them, and also you can write the examination and test needs for your patient. In the prescription tab, you can see our prescription from our application based neurological proposed, and you can set your drug for your patient. And if your patient needs a visit, attendance visit, and you need to see him or her and talk about the problem, you can choose yes and send them for your patient. Okay, in the next part, in the patient list and in action, you can see a referral icon. In the referral icon, you can send your patient to other patients with different specialties. For example, if you are a neurologist, you can send it to your his or her radiologist, or you can choose another doctor for his work, and you can consult with another doctor. For example, you can set the doctor's name, and you can see more information about that doctor, and you can see their user race, the specialist, the medical doctor number, and their gender. Okay, and you can select the prescription and test that your patient were done, and also you can clarify your referral type and talk about the reason and send it to your patient. The next and another important feature in the action part is medical advice. In the medical advice, you can choose your patient name, select their type of disease, and choose the test and prescription, and after that you can enter the doctor names and talk about the subject and write and explain about the description and explain about what is wrong with that patient, and share it with another doctor and with also the patient. That different type of doctor can contribute with each other to help the different type of patient. Okay. The next part in the menu part is medical advice. In the medical advice tab, you can also do this work in this part, and you can access both in the patient list tab and also directly from this part. The next tab is finance. The financial part, you can see different type of tab. You can see your wallet and how much you earn from your patient. You can see a different other information and history of your patient. For example, what is the service you have done, and their status and their time and their details that show more information about your service. Also, in the set of medical status, you can determine your service. You can plan for your cost and how much they must pay for their visit, and add them to this part in the service panel part. And you can see, and your patient can see this part after they choose your name. And then in the last tab, you can identify, and you can set your address. You can either your presence time in the medical center or your clinics or different part, and add your panel. Okay, all of this part is to talk about our application, and but two different parts is remaining. In the patient list and medical advice item, you can access all the part that I mentioned, and you can access them from this place also to use it better and give it best feeling. The next part and the last part in our panel is messaging. In the messaging part, you can communicate with your patient in a different manner. For example, in your inbox, you can see which patients send you a message, and can you see content again? You can see the subject and what is the description they said. You can take the description from your patient, and can see, you can send a message to your patient also, and select the subject and talk about that. You can send the message. You can see the send message after you write them to your patient, and you can see all of them in this chart. And after that, you can archive that or put them in the archive list. Okay, all of them is talk about this panel is all the specification and features of the panel, doctor panel in the neurological disease diagnosis based on neurological application. In the next video, I want to talk about our admin panel in that video. So have a good day and bye.